In part 2 of our interview with Brad Williams, we talked about the complicated processes of patient assistance programs. Now, patient assistance programs were designed to work with you and your doctor's office. And patient advocacy has come along later because of the hard needs. But what are the challenges for doctors' offices and free clinics who help people to get on these life-saving programs? We talked more with Brad, and he explained. Now, they have to go to their doctor's office to get these patient assistance programs applications signed, and their doctors charge them every time a doctor's office fee to do that. Do all patients have to pay that fee every time they need a form signed?
Sometimes. It really depends on the doctor, though. That's why it's so difficult. There's so many possibilities out there. Some doctors every now and again will sign your paperwork if you show up, if you have a good relationship with them. But when you go to a doctor's office, most doctors will insist upon it being a doctor's visit, and doctor's visits are paid for. As a result, yes, in many cases, it costs a lot of money to do this.
But can't you just, go up to the reception clerk at the doctor's office and drop off the paperwork and have the doctor sign it when he has time and come back and pick it up? I mean, can't you do that? Don't the doctors care to do that?
Absolutely. But you've got to remember also, whereas certain doctors will do that, all doctors have different ways of doing business, different ways of practicing. Certain doctors actually charge to sign any type of paperwork whatsoever. These are difficult situations. It sometimes takes our assistance to deal with the doctor to let them know what these people are dealing with, to know that they're in a difficult position and they need their medications. Certain doctors have, in fact, certain doctors' offices have policies in terms of what paperwork they can sign and what they can't. In these cases, this is a great thing when we become involved. That way we can work with the doctor's offices to help them understand that this is the necessary path these patients should take to make sure they get their medications. Some doctors' offices are worried about working with these programs. This is difficult. We explain what they do, how they get their meds, and how it helps these people, and the doctors are helped as well, knowing that these patients are actually receiving their medications.
Pharmaceutical companies have designed patient assistance programs to work with patients in their doctor's offices, for the most part. So they pretty much put the onus of doing this work onto the doctor's offices. Can you kind of walk me through? I know we work with several thousand doctor's offices and help make these processes easy to help their patients. Can you walk me through what it's like for most doctor's offices when they're dealing with patient assistance programs?
Well, you've got to remember, doctors went to medical school, nurses went to nursing school. Dealing with patient assistance programs isn't what they do. That's not what they do for a living. They see patients, they evaluate their illnesses, they try to help them, and they find out what prescriptions they may need. But helping them get their medications, that's not what they do. Certain doctors' offices are able to assist, but for thousands of doctors' offices across the country, they're overburdened with patients. They're pouring in the doors. They need assistance. We take up and do all of the solid paperwork and all the assistance in taking care of making sure these patients get their meds. Our benefits for the doctor's offices are literally two. One, we make sure that they know that their uninsured patients are taking the medications they need for their health, so they can keep track of that. But more to the point, we take a massive burden of work off the doctor's offices that they're not designed to assist with. They're not designed to work with pharmaceutical company A over here, deal with pharmaceutical company B over here, and call about when medications are going to show up. What's going on with the patient's file? They're having a hard enough time keeping up with their patients as it is. We make sure their patients get their meds, and we make sure that the only thing the doctor's offices need to do is sign off saying, this is exactly what this patient is taking, this is what I want them on, and then their job is solved. Then all they know is that their patients are taking the meds that they need.
So we work with a lot of doctors' offices. How do doctors' offices view us as patient advocates?
We work with thousands of doctors' offices, and thousands of them love us. We take the onus really off of them in terms of a lot of work, and they worry about these patients. They're their patients. They worry about if they're getting their medications or not, and a lot of them, some of them have in fact in the past tried to assist them with a lot of these programs, but the work is too great. It's hard enough to see their patients, much less try to take care of a lot of these issues for them. And now we can imagine just a patient with 5 or 6 programs. How is it possible for a nurse, when she goes in with a list and appointment of everyone she needs to see this day, to take time off to sit down and try and find out when a certain medication is going to arrive at the doctor's office or going to the patient's home? When is this happening? The workload is simply too great. Thousands of doctors' offices love the fact that we keep these patients, we take care of them and make sure they get their meds, and we make sure that all of this extra work is taken off their backs.
So tell me a little bit, we work with lots of doctors' offices, lots of free health clinics. We've worked with just about everyone, hospitals. what about doctors' offices who have been doing this on their own for a while? What have we seen from this? Good and bad results. What's the real picture of doctors' offices trying to do this?
Well, mixed results actually. A lot of doctors' offices try to assist their patients because they know that they're in a difficult position. But what they find is they can't take care of a massive amount of patients, one, and they certainly can't handle the massive workload. Some are able to do it for a few patients, but most can't do it for many. Most appreciate the workload that we handle, but what they find is in the hustle and bustle of their office every day, with hundreds of patients that they see, from hospitals to free clinics especially, to small doctors' offices, that they just can't keep up with the matter. So even when they try and they care so deeply, they're unable to actually keep up with it at the level that we can, because that's all we do. We have a commitment to making sure they get their medications and following up with these programs to track what's going on. These companies all operate differently. As a result, a lot of these doctors' offices just can't manage the workload. And most that have tried love the fact that this is what we do, because they understand the fact we take care of our people, and they understand how we operate, and they know that patients aren't falling through the cracks like they have previously sometimes when they've worked on patients.
I know we get referrals from doctors' offices every day. We get referrals from the actual pharmaceutical companies. When people mess their paperwork up, they send people to us. What I've noticed from doctors' offices is that in order to do this properly, they have to create a whole different department almost in order to do this. And then they start off, they don't have the technology we have. They haven't been doing this for as long as we have, and invested the time and energy of becoming experts and trained their people. They're using paper applications. They aren't up to date on all the guidelines. They use some of the public websites that have a lot of out-of-dated information, a lot of those things. But the one thing I've noticed, and I'd like you to speak to, is that they're normally successful after some time of getting people their first 90 days of drugs. But what normally happens after that? And most of these doctors' offices I've noticed, they just say, like most people think, it's just paperwork. You send in the app and everything's good. But what happens to patients after they get that 90-day supply of drugs when they're counting on their doctor's office or even their social workers to help them?
Well, in a lot of cases, you made a great point. A lot of these people wind up getting left out in the cold a little bit. Their refills don't get done, some further paperwork doesn't get handled for the next refill, and a lot of times something doesn't happen. Well, inevitably the result is the patient doesn't get their meds. A lot of times, a lot of these doctors, they don't have the software developed to manage these patients on these accounts. They do look at it and say, you know what, these are just forms. This is a simple process, but this isn't what doctors' offices do, so it's very easy not to keep up with it because it's not how they do what they do. It's not what they handle during the day. They're very good at prescribing drugs and finding out what's wrong with you, but they don't assist you in getting the drugs. When they try to do this, typically, patients do fall through the cracks every now and again, and it's very unfortunate. That's one of the main reasons we're around, because that's the only thing we follow. We keep up with the dates and make sure that they keep getting their meds on a constant basis. Now, many of these doctors have great intentions, or the nurses, in fact, they're following the file, but they're not equipped to take care of this. Though very competent and with all good intentions, they simply can't manage this one other aspect. And some doctors' offices do create almost a new department of nurses that just handle this. Most of them are overwhelmed and they simply cannot continue. And as a result, a lot of patients do without.
Can the clinics and doctors' offices afford new departments just to take care of their uninsured patients, who a lot of times they're seeing for free or whatever anyway?
Not at all. I mean, when you look at it, think about this. The doctor's offices, it's very easy to go in to see a doctor if you have insurance. If you don't, a lot of them require fees up front. So at the same time, if you're also creating departments to help uninsured people to do things that don't actually generate revenue really for the doctor's office, it doesn't relate to what they do. It's really a massive expense. And though we know a few have tried to do this, a lot of them discontinue it simply because it's just not worth it. One, they're not equipped to do it. Two, they're not experts at what they're doing. They're just attempting to help out. And three, it's difficult for a lot of clinics to do this because it hurts their bottom line. It doesn't really help bring in anything. But that's where we come in. We are experts on this. We only charge basic membership dues for the services to make sure people receive thousands of dollars worth of drugs every year, and people don't fall through the cracks with our system. We make sure they keep getting their drugs.